I'm Maggie.
I'm Lottie Tkachik.
Hi, I'm Muscles.
I'm Juliet, and we're going to be talking about steroids.
Steroids are synthetic hormones that are derivatives of testosterone and are usually used medically to promote tissue growth and are sometimes abused by athletes to increase the size and strength of their muscles and to improve endurance.
If you chose to take steroids, here is a list of some of the side effects that could occur. Bleeding into the joint, rupture of a tendon, skin discoloration, acne, blurred vision, easy bruising, difficulty while sleeping, increased appetite, which would initially lead to weight gain, muscle weakness, nervousness and restlessness, stomach bleeding, sudden mood swings, swollen or a puffy face, water retention, and swelling. If you're a male, here are some other things that could happen to you. Balding, shrinking of the testicles, impotency, and pain when urinating. If you are female, facial hair growth, shrinking of the breasts, and a deeper voice. And there are also some more long-term effects that would not occur right after you chose to take these drugs. These include liver failure, cancer, and mental illness such as increased aggression and violence, and also suicide. If you chose to take another drug, such as cocaine or meth, while on steroids, here are some other side effects. These are death, a coma, stroke, and heart attack. Do not take steroids. These can and will happen to you.
Oral steroids and injectable steroids. Oral steroids are usually taken in pill form, but can also be taken in syrup form. The pill form puts more stress on the liver because it has to be taken multiple times a day. Most injectable steroids only have to be taken once or twice a week. It is usually injected in the glute, shoulder, or thigh. In some rare occasions, people crush the pill and sniff it up.
A study taken with anonymous steroid users showed that although there are no really addicting substances in steroids, people keep coming back because of the happiness it gives them. One of the side effects of steroids include depression, and the only way to get rid of that depression, the user thinks, is by buying more steroids. So it's not technically addictive, it's more just psychologically addictive, not physically. And also because they experience symptoms of withdrawal, extreme symptoms of withdrawal.
There are many effects of withdrawal from steroids. These include weakness, fatigue, decrease in appetite, weight loss, nausea, vomiting, diarrhea, and abdominal pain. These effects can mimic many other medical problems and can sometimes be life-threatening.
So here's some common street names for steroids that you should listen for and just keep an eye out. If you ever hear them, then you know that there might be some steroids around and that you should probably steer clear. So here they are: roids, juice, hype, gym candy, Arnold's, stackers, pumpers, and weight trainers. So if you ever hear these, steer clear. No gym candy. Don't buy steroids.
If men take steroids, they might become bald, develop breasts, and testicles may shrink. If women take steroids, their breast size and body fat decreases, the skin becomes coarse, the clitoris enlarges, and the voice becomes deep. If an adolescent were to take steroids, their height will be stunned, which means they will be short for the rest of their life. Both genders can develop cardiovascular diseases like heart attacks and strokes. They may also develop liver tumors and blood clots. Users may share the same needle, which can transmit HIV or hepatitis B and C.
Steroids, a very highly dangerous drug, thankfully does not have any truly life-threatening symptoms, although that does not make them any less dangerous toward your health. If you experience any of these symptoms, the first thing you should do is call 911. These symptoms include, but are not limited to, burning or itching of the skin, convulsions, deafness, dry skin, high blood pressure, muscle weakness, and nervousness. The most dangerous of these symptoms, however, is depression, which leads to suicide and extreme cutting and harming.
In 2009, I set out to make a film about Lance Armstrong's comeback year. Lance, how you feeling?
Nervous, but that's good.
When the truth came out,
UCI would ban Lance Armstrong from cycling.
I told him he owed me an explanation. He had lied to me, straight to my face.
I can emphatically say I'm not on drugs.
So I decided to film the real truth.
I certainly was very confident that I would never be caught.
If I win again, they're not gonna. They can't say that. They cannot. Well, you can, but.
That urge to dominate is what ended up bringing him down.
Lance tried to dominate my film, too.
He was an immensely intimidating person.
You are not worth the chair that you're sitting on.
If you crossed him, you were doomed. This is not a story about doping, it's a story about power. And the story became hanging on to that power.
What did he know that I didn't?
The real nature of the story.
We haven't heard it yet.